So what if something else was responsible for hyperglycemia? Okay, glucagon is a big one. And lastly, what if insulin resistance is intentional and beneficial by the body? Does mind if I take a sip? Yeah, this is a big topic too. I'm just going to read you some of this from this because this is I couldn't put it better myself. Stress hyperglycemia, an essential survival response. And they were excited when they wrote that. Stress hyperglycemia is common in critically ill patients and appears to be a marker of disease severity. Okay? Because of this, in hospital settings, they say, well, hey, we need to get rid of some of that glucose because that's clearly not going to help them out. But wait, furthermore, both the admission as well as the mean glucose level during the hospital stay is strongly associated with patient outcomes. A critical appraisal of the literature has demonstrated that attempts at tight glycemic control in the ICU and non-ICU patients do not improve healthcare outcomes. This is, once again, you guys, we look at this, we're like, oh, they have hyperglycemia. Clearly that's a problem. Let's lower that. And it turns out it doesn't necessarily help. Maybe it's because it's intentional by the body. They say we suggest that hyperglycemia and insulin resistance in the setting of acute illness is, ready, an evolutionarily preserved adaptive response that increases the host's chance of survival. So when you see something like this, guys, I mean this so much, you can look at a patient and say, is your body doing this on purpose? Does it want high glucose? And we're like, of course not, because look at how damaging it is. Acutely, maybe it served a purpose. Chronically, maybe that's when it starts to be problematic, but maybe some of the acute problems that we used to have are becoming chronic and our body is merely responding to them. Anyhow, furthermore, attempts to interfere with this exceedingly complex, and if you ever get confused about the body, it knows way more than we do. Multi-system adaptive response may be harmful.